I'm Anna Happel, a postdoctoral fellow at the University of Cape Town, and as president of the ISAPP Students and Fellows Association, it is my pleasure to introduce the first Students and Fellows speaker, Rita Ferreira. As a PhD student at the University Medical Center Groningen in the Netherlands, Rita has been extensively involved in the development of new in vitro and in vivo models to study host microbe interactions during chemotherapy-induced mucositis, and will present some of this work here today. Rita, over to you.
Hello, good afternoon, everyone. Anna, thank you very much for this nice introduction. And I don't think I need to say anything else. You introduced me quite well. And once again, thank you for this invitation. It is a pleasure to be here to present my work. Today I decided to discuss in this conference with you how Blautia lutein can attenuate toxicity induced by 5-fluorouracil during gastrointestinal mucositis. First of all, I have no real or apparent conflicts to report. And now I would like to briefly introduce you about what mucositis is. Mucositis is an inflammatory disorder that affects mucosal and submucosal cells outlined in the intestinal tract. This is one of the most debilitating side effects of chemotherapy, and it has several side effects associated, including diarrhea, nausea, bleeding disorders, and often infections or even sepsis. And mucositis is characterized by the appearance of ulcerations throughout the gastrointestinal tract, and it's also characterized by villous atrophy. As you can see here in this figure, there is a significant reduction in the intestinal villi, and this has, of course, consequences such as reduced nutrient absorbance and also drug delivery. So as you can see, it's a quite debilitating side effect in cancer patients. According to a model proposed in 2004 by Sonis, mucositis can be divided into 5 stages. So in the initiation phase, the radiation or the chemotherapy, as you could see in the title, I will focus mainly on chemotherapy, and the chemotherapeutic drug used here was 5-fluorouracil. So this chemotherapy or radiation will break the epithelial layer from the gastrointestinal tract, either by direct damage or by the production of reactive oxygen species. These reactive oxygen species will activate specific pro-inflammatory cytokines, including NF-κB pathway, and this will lead to the production of massive amounts of pro-inflammatory cytokines and chemokines, and ultimately this exacerbated inflammatory response will result in the break of the epithelial layer and in the translocation of the bacteria that are in the gut to other sites of the body. And this is one of the main reasons why most of these patients can suffer from infections or even worse from sepsis. However, a few days after the initiation of the treatment, there's the healing phase, and the epithelial layer is restored, and also the inflammation is reduced. So how is the gut microbiota related to the development of mucositis and also related to mucositis symptomology? I'm not going to focus a lot on this figure, especially because I think we all know a little bit about it, but we know that in a situation of homeostasis, we have in the gut a balance between commensal bacteria and pathogenic bacteria, and this prevents or suppresses several inflammatory responses that ultimately will lead to apoptosis and the break of the epithelial layer. So we have homeostasis in this specific case. However, during a situation of dysbiosis, for instance, after chemotherapy, this balance no longer exists. We have a significant reduction of commensal bacteria, and these ones are replaced by pathogenic bacteria, which will result or which will lead eventually to an exacerbated inflammatory response, and finally to apoptosis, so the break of the epithelial layer. We know in the setting of mucositis, in these past few years, several studies have been focused on developing new interventions that target the gut microbiota. Among these interventions in our group, we have been testing several pre and probiotics. Also, vitamin C and vitamin B2 have been tested. In this case, of course, Blautia has been tested as a probiotic, as you will see. FMT was also one of our focus, among others. So we can say from this that the microbiome has the great ability of modulating cancer treatment efficacy and toxicity because it can influence several factors. It can influence drug metabolism, it can influence mucosal immunology and inflammation. And one of the things that, of course, it can influence is the gut-brain axis. It has been shown, literature has been shown that chemotherapy not only affects the gut microbiota, but also the central nervous system. And given this link, recent or more studies have been trying to show how to modulate the composition of the gut microbiota in order also to reduce inflammation that is caused by chemotherapy. So this balance is also very important, and it has been a lot of people has focused on that. So giving all this, the main question in this work was whether bacteria could be targeting the gut in order to alter the course of gut toxicity during cancer therapy. So for that, a few years ago, in collaboration with the University of Adelaide in Australia, we performed a retrospective cohort study in which we included 12 patients undergoing standard doses of 5-FU. And we asked these 12 patients to give 2 samples, one sample before the chemotherapy cycle and the other sample at day 5, so the peak of mucositis, which usually is also associated to severe diarrhea. And we split these 2 groups into non-toxic, so the ones that did not present any diarrhea or low scores of diarrhea, and the toxic group that presented high scores of diarrhea. And interestingly, what we saw when we analyzed the composition of the gut microbiota and we performed principal component analysis was that these 2 groups were separated. So the microbial profile is distinct. And when we analyzed in more detail, we also observed that the relative abundance of Blautia genus in the non-toxic group is significantly higher when compared to the toxic group. And even if we go a little bit more into details, if we go to the species level, you can see here that Blautia luteii, this non-toxic group, has significantly higher expression of these species when compared to the toxic group. And you can also see this when in this correlation coefficient in which we saw that the presence of Blautia is positively correlated with the non-toxic group. So we thought, okay, maybe Blautia can drive this positive outcome in the gut microbiota, and in this case in cancer treatment. But what is driving this phenomenon? What is making Blautia doing all this or driving all these positive outcomes? So for that, we did a series of in vitro assays in which we isolated Blautia luteii from fresh human feces, and we cultured anaerobically with YCFAG, which is our selected media to grow bacteria, and then we isolated supernatant. We decided for this project, for this work, to focus mainly on supernatant and not in the bacteria itself. And then we did a series of studies. We first, as you can see here, we focus on 3 main pillars. So how can Blautia interfere or modulate the composition of the gut microbiota under oxidative stress conditions? How can Blautia manipulate, or if it can manipulate, of course, the immune response? And of course, if it can have some effects on intestinal epithelial cells, which are the most damaged cells during chemotherapy. So we started by checking for assessing the cell proliferation and barrier integrity. For that, we use TAD4 cells. TAD4 cells are intestinal epithelial cells. We use them as our cell model, and we performed two types of assays. So we checked for the proliferation of the cells, as you can see here in these two first graphs, and we also assessed the barrier integrity, so the changes in TER. And regarding the cell proliferation, you can see here that when different concentrations of the bacteria are added, we had more cell proliferation when compared to the controls. And also here, in terms of the TER, so the barrier integrity, we also see that a higher concentration of Blautia can lead to an increased increased barrier integrity when compared to the other conditions. Another thing that we also assessed was the formation of tine junctions, because Blautia has been associated also with the formation of tine junctions in epithelial cells. And when we compare the control group with the one simulated by Blautia, you can see that there's the formation of more tine junctions when we label them with the occludin 1. We also wanted, of course, to characterize the short chain fatty acids composition in the Blautia supernatant. And as you can see here in this figure, Blautia supernatant had a high concentration of acetate when compared to propionate and butyrate. And this is quite interesting because acetate has been associated with pro-barrier effects in vitro and in vivo, and it has also been shown to promote tine junction assembly. So maybe this is the reason why we also see the formation of tine junction in our studies. However, the role of Blautia in cell proliferation is still unclear. Finally, regarding this pillar, another thing that we did was to test the ability of Blautia supernatant to attenuate 5-FU toxicity. So for that, as you can see here in this figure, we tried 3 different approaches: the prophylactic approach, concurrent approach, and therapeutic approach. So basically what we did was to grow TAD4 cells with the supernatant, and then we added 5-FU, of course, according to the different approaches that we test. And this is the result. We can see that all 3 approaches that we tested, so the prophylactic, concurrent, and therapeutic, show that the cell proliferation is significant. It's higher when compared to the positive control. So 5-FU, which basically killed all the cells, so the cells did not grow over time. But we got better results with after 96 hours of incubation, prophylactically and concurrently. Although we still see a trend in the therapeutic approach. Next, the second pillar, as we like to call, we also tested we also tried to characterize the properties as an anti-inflammatory compound of Blautia. So for that, what we did was to use human monocytes, and we differentiated these human monocytes into M0 macrophages using PMA, and we tested the 3 approaches, so the concurrent, therapeutic, and the prophylactic. However, here I'm going only to focus on concurrent and therapeutic. And for the concurrent, what we did was to stimulate with LPS and interferon gamma these M0 macrophages, and at the same time we stimulated with supernatant from Blautia. And regarding the therapeutic approach, we first gave the inflammatory stimuli, and then we treat them for 24 hours with the supernatant, and then we characterize the cytokine profile of these macrophages. And as you can see here, we had quite interesting results, especially with the therapeutic approach. We measured, as I mentioned, a panel of cytokines, but we only saw significant differences with the IL-10, and that's the reason why I'm also showing here. And we see an increased production of IL-10 in macrophages treated with Blautia, and this is paralleled with a reduced production of nitric oxide. We do see the same trend, although not significant for the concurrent, but we also see significant reduction in nitric oxide production for the concurrent approach. This is just a figure to show you that although we saw those differences, we did not see any changes in terms of phenotype of macrophages during the therapeutic approach. Finally, we tested, or we assessed, the ability of Blautia supernatant to promote the growth of commensal bacteria or to prevent the pathogenic bacteria. Basically, we wanted to understand whether this supernatant, whether if in culture under oxidative conditions, if it could somehow manipulate the growth of bacteria. And indeed, we saw that. We saw that, for instance, with Faecalibacterium prosnitzii, after 48 hours of growth under oxidative conditions, Blautia can increase this growth when compared to the control. And the opposite happens, for instance, with Escherichia coli. After 48 hours of incubation with the supernatant, different concentrations of the supernatant, we can see that the growth of E. coli is significantly reduced. So this was a very interesting result, especially because we could somehow prevent the expansion of E. coli. As main conclusions, regarding the composition of the gut microbiota and how can Blautia somehow manipulate the composition of the gut microbiota, what we concluded from this work was that, at least with Faecalibacterium prosnitzii, we can see an expansion of this bacterium under stress conditions, and we also saw a prevention of E. coli growth. We want to, of course, test a bigger panel of bacteria that are especially related to changes that occur during mucositis, but for now we see these results as promising. Regarding the intestinal epithelial cells and how can Blautia not manipulate but attenuate toxicity, we saw a beneficial physiological effect. So Blautia supernatant alone is able to increase the cell proliferation, and besides that, it can also attenuate 5-FU toxicity in all the three investigated approaches. And finally, regarding the immune response, we observed an immunomodulation via increased production of IL-10 in the therapeutic approach, paralleled with a reduction of nitric oxide production. So, taking all this into account, we of course we still have to perform more experiments, and we have future experiments plan for this work, and our main aim here is to develop next generation probiotic using perhaps Blautia that can attenuate mucositis as the gut microbiota has been linked to the brain. We also plan in the future to understand a little bit and investigate a little bit more about that, especially in the setting of mucositis. With all that, I would like to thank to all these people here, Anna, Mafalda, Daniela, and Rafael for all the help, and to my supervisors, Dr. Hannah Wardil, Dr. Wim Tissing, and Dr. Hermie Harmson, and to my FundMe group that we have been together for the past 4 years. And if you have any questions, please let me know. Thank you.
Thank you, Rita, for an excellent talk. We unfortunately only have time for one question, but Gregory is stating that a common problem with all microbiome studies is that we need quite large sample sizes in order to prove causality. And that's obviously not easy for cancer patients without having access to multiple clinical sites. Do you think that FMT could be spiked with Blautia and given prior to chemotherapy to improve outcomes?
Sorry, can you repeat? I'm sorry, I couldn't.
Do you think that FMT samples could be spiked with Blautia and given to patients prior to chemotherapy?
That's exactly one thing that we are trying. We just published a paper on FMT and how can FMT improve the composition of the gut microbiota and mucosary symptomology. And given now this nice work that we are developing, that's definitely in future perspectives. Try somehow to modulate or manipulate this FMT with not only Blautia but perhaps even Faecalibacterium prausnitzii, even though it's quite complicated, but we are trying to.
Excellent. Thanks so much, Rita. There are some more questions, but I'm sure you can address them offline. Yeah, with that, we are coming to an end of the session. Thanks to all the open registration participants for attending today's session. Please join us tomorrow for more talks. And to the participants who also registered for the closed sessions, your program will continue after the break. See you at 11:45 a.m. Eastern Time or 1/4 to the hour for the ISAPP member session on the live stream. Thank you.